I want you to look me in my eyes and tell me you believe that doctors know every medication in this drug book. You don't believe that? Then why are you trying to learn every medication? Stop trying to memorize the meds. Learn the endings. Past the NCLEX. We are focusing on the suffixes, the endings of these medications, because there's so many medications, it's impossible to learn all of them. I'm going to talk about 4 major cardiac meds. Pril, lisinopril. We all know lisinopril. Things that end in pril is the drug class of an ACE inhibitor. So for ACE inhibitors, we want to watch out for a cough. Hallmark sign of ACE inhibitors is a annoying, irritating cough. Increased potassium, angioedema. Angioedema is a life-threatening sign. They need to go to the hospital immediately. That is the swelling of the lips, the tongue, the throat. Everything swells up because that is a severe allergic reaction. So when we talk about statins, that is an angiotensin receptor blocker. So here, that also will have an increased potassium and fetal toxicity. So you do not want pregnant women on this drug. That is just a no-no. They can go on something else. LOLs, my favorite, the LOLs, the metoprolols. I love that drug. That's a beta blocker. So here we're going to be at risk for bradycardia, of course, fatigue. So when I think of beta blockers, I just flip that A and that T around, and I call it a beat blocker because it blocks your heartbeat and it slows it down. That's how I remember it. So bradycardia. And then lastly, the PENS, calcium channel blockers. So here we have edema, and you could have reflex tachycardia, but we have the edema because the calcium channel blockers work to relax those blood vessels, right? So if we dilate our blood vessels, we know that we are allowing more blood flow, which is also going to put us at risk for increased swelling. And then the reflex tachycardia is our body responding to that drop in our blood pressure, and so it's going to increase our heart rate. We're making it easier. We're not trying to complicate things. Follow me if you found that helpful and you want to learn more medication tricks and other helpful tips for the nursing exams and the NCLEX.